Good morning, everyone. I'm Divya from Visionary Eye Hospital. My topic for presentation is role of ASOCT in diagnosing deep fungal keratitis. The scope of the presentation are background, role of ASOCT in diagnosing deep fungal keratitis, study and the clinical relevance of the study in our practice. Infectious keratitis is one of the important causes of corneal blindness in our country. There are many kinds of pathogens that cause corneal infection. So the clinical manifestations are complex and diverse. So it's very important for early, rapid and clear diagnosis for an effective treatment. Traditionally, infective keratitis is diagnosed using smears and culture. But however, these tests are invasive and cannot be performed in deep-seated infections, especially with an intact epithelium. So in recent years, endothelial plaque caused by infective keratitis have gradually attracted the attention of ophthalmologists. Endothelial plaque is a characteristic sign of fungal keratitis. However, other infective keratitis like bacterial also show endothelial-like plaque due to deposition of fibrin. But on slit lamp examination, due to corneal edema and the infiltrate present in front of endothelial plaque obscures the view of endothelial plaque, making it difficult to distinguish fungal from other infective keratitis. And also in these deep-seated keratitis with endothelial plaque, scraping cannot be performed as material is inaccessible. So it is important to find other examination methods to observe this endothelial plaque. In this study, we have used ASOCT to study the characteristic features of fungal keratitis with an endothelial plaque and to differentiate it from other infective keratitis. It is a prospective observational case series conducted at Visionary Eye Hospital from December 2020 to August 2023. 4 cases of deep fungal keratitis with an endothelial plaque and with an intact epithelium where smears and cultures cannot be performed were included in this study. ASOCT with a corneal module attachment in cornea cross-section line mode is used to evaluate the boundary between the endothelial plaque and corneal endothelial cells. So these are the results. Among 4 cases, 3 are male and 1 is female. 3 had history of injury with vegetative matter and 1 had history of fall of unknown foreign body. 3 underwent therapeutic penetrating keratoplasty and 1 resolved with targeted therapy. And all the 4 cases showed unclear wavy border between the endothelial layer and endothelial plaque. So these are the slides showing the clinical and ASOCT where the border is wavy between the endothelial cells and endothelial plaque. So conclusion of this study, in fungal keratitis, there is an immune reaction to the penetrated fungal hyphae, which results in production of the endothelial plaque, which shows wavy and unclear boundary in ASOCT between the endothelial cells and endothelial plaque. So clinical relevance of this study, so ASOCT can be used as a non-invasive diagnostic tool in diagnosing and differentiating fungal keratitis from other infective keratitis by observing the border which is wavy and unclear, hence helping in timely treatment, especially in cases of deep-seated fungal keratitis with an intact epithelium. Thank you.
Differentiate between a bacterial and this one, like ASOCT. In all cases of fungal, you are getting the same features. What you are getting?
So we have done only for fungal keratitis, sir, and 2 cases of bacterial where the border is it's not a wavy, it is a clear border between the endothelial plaque and.
Can you stamp that what you are doing is how correct it is?
So actually we have done TPK in 3 cases. 1 there is no growth and 2 cases showed fungal cultures.
I don't have many cases, what I mean to say. Hardly or 7 or 4 or
4
5
cases.
cases.
The limitation of the study is
so
the
what I
smaller
mean to say,
sample.
Can you stamp, like suppose you are doing 20-30 cases and getting the same findings, that may help, what I mean.
Yes, sir.
So keep doing the study and write a paper on that.
Yes, sir. Sure, sir.
Which version of the anti-segment OCT were you using?
We have NIDEC.
If it's showing a heat map, that also helps you to analyze.
Okay.
You can try an image analysis nowadays. A lot of engineers are looking at images and allowing pixel analysis. So
Okay.
that would be a good
Okay.
Dr. Sudhakar Naidu Lavati
Thank
is
you.
ready.